Dr. Merchant, firstly, thank you for teaching us about the importance and the value of performing wideband tympanometry measurements in the clinic. Could you tell us a bit about where your passion for this measurement technique comes from?
Yeah, absolutely. So it's a great question. I started doing wideband tympanometry or similar types of measurements almost 20 years ago when I was an undergraduate student training with Dr. Susan Voss at Smith College. It was one of my earliest research experiences, and I got really interested in how these measurements might be clinically applicable. And I had a bit of an atypical training trajectory in that I completed a PhD after my undergraduate degree and then went on to do a clinical degree in audiology after that. And so during my dissertation, my PhD work, I also used wideband tympanometry measurements. And then as I went through my clinical training, I saw so many instances in which I thought that those measurements could be valuable. And so as I transitioned to starting my own laboratory, I was very passionate about sort of bridging this gap between research and clinic and finding ways to advance sort of the translation of these wideband measurements, mostly because I saw so many opportunities where they could really advance our clinical diagnostics, especially in pediatric populations, but really across the lifespan. And so I think it was having that sort of foundation on the research end of things and then seeing the places where we could apply it in clinic definitely is what sort of drives that passion.
You mentioned in your presentation that not all clinicians are performing these measurements. How commonly would you say these measurements are being performed in clinics across the world?
Yeah, that's a really great question. It's a bit difficult to quantify. So I would say 5 years ago, probably on the order of 5% or less of clinicians were likely doing these for clinical purposes. These measurements have been in the research literature for upwards of 20 plus years, probably more like 30 plus at this point. But I would say in the last 5 years, I have seen a big shift towards more clinicians both doing these measurements or definitely expressing interest in doing them. I think that we have really seen a transition in medicine in general towards more precision medicine techniques, and I think sort of advancing our clinical diagnostics to higher levels of precision sort of aligns with that transition. And so in addition to that, my laboratory and others have really worked on, what are the barriers and looking at those barriers. And I think by trying to find ways to overcome those barriers, including by doing trainings and thinking about how we can simplify interpretation, those have really helped us sort of translate these measurements to clinics. So now I would say I get an email at least every couple weeks, probably multiple a month, from a clinic that has done a training, seen a webinar, something of that sort, and they've started to use these measurements in their clinics, and they often reach out with a question or two. And so I would say we're probably closer to 10-15% of clinics, and I think that number is growing rapidly.
One of the barriers mentioned in your research paper is around interpretation and training. Often individual measurements will fall slightly outside of the normative data range or not follow those simple patterns of 226 Hz tympanometry. What would be your top tip in interpreting individual wideband tympanometry measurements rather than looking at group data?
Yeah, it's a challenging question and one we're continuing to try to think about how best to tackle. But right now what I would say is to try to resist the urge to sort of pattern or template match to things you see in the literature, particularly that group level data, because individual measurements are going to have a lot of fine structure that you don't see when you average a lot of data and see these nice smooth measurements. I think you do have to really kind of think back about the mechanics and what these measurements are telling us. So we're looking across a broad frequency range, we're getting information about stiffness, dominated characteristics at the low frequencies, mass characteristics at the high frequencies, the resonance characteristics. And I think if you can sort of think about what it's telling us about the mass and the stiffness and the resonance, it can still be a relatively simple interpretation, but you can compare it to norms that way. And then also add that sort of piece to your puzzle of the other assessments in your battery. So if you have someone who doesn't have conductive hearing loss and doesn't have any auditory complaints, and it's a bit outside the normative range, that's probably just consistent with whatever the mechanics of sort of their normal middle ear is. But if you have someone that has a conductive hearing loss and reduced wideband tympanometry absorbance in the low frequencies, that's telling you that conductive hearing loss is likely due to some increased stiffness in the system somewhere, perhaps due to otosclerosis or something similar to that. So thinking about sort of the broad mechanical effects and how that couples to what you know from other testing you've done can be probably the most useful thing you can do.
And once the barrier of interpretation has been overcome, what has the feedback been from those who have incorporated wideband tympanometry measurements successfully into their clinic?
Yeah, I've actually been shocked with how much positive feedback that I have received personally from clinicians who have started to do these measurements and very quickly seen the value added to their clinical practice. In addition, the otolaryngologists and ENTs that they collaborate with often have been told that they have also seen quite a large value add and become really excited about them. We have been doing these measurements in our clinics at Boys Town for about the last 9 months. So we rolled out sort of an implementation of this broadly across all of our clinics. And we initially rolled it out just for pediatric use. We sort of thought approaching it by doing this just on sort of a very isolated population where the effects are quite large would be a good starting point. And I was shocked at how quickly the audiologists both got comfortable with it, got comfortable interpreting it, that our ENT started asking for it, to the point where they are now asking us for support in transitioning to also doing this in our adult evaluations. We have ENT specifically requesting the audiologist to do this in certain adult cases. And so I think as soon as you start doing it and starting to see the value add, that happens quite quickly. And I think there's been a lot of excitement from what I've seen. I've had people say they were able to borrow equipment to try it out and very quickly purchase the equipment themselves for their clinic. So I think it's just a matter of sort of getting going, and you will start to see the value that it can add to your evaluations.
We've seen from your presentation today that there's a very clear benefit for pediatrics in being able to predict hearing loss in those patients with middle ear effusion. Where do you see the next stages of this research going?
Yeah, so right now, I think we have some good tools to help individuals and clinics interpret these measurements sort of visually based on the responses that you're seeing. But our goal really is to utilize machine learning and AI to develop tools where an audiologist or a provider could make a quick wideband tympanometry measurement, and that an algorithm could automatically spit out both some information perhaps about what it's telling you about what pathology is present. So for this pediatric otitis media application, maybe characteristics of that, like how much fluid is in the middle ear space or the volume of that effusion, and as well as sort of an estimate of how much conductive hearing loss is occurring as a result of that conductive component. So sort of automate all of that so it sort of takes that individual person's interpretation out of the puzzle and makes it even more objective.
Do you see any other clinical applications for this type of technology in the pediatric population?
Yeah, so one thing we are currently working on is whether and how these wideband tympanometry measurements might also be able to help us predict the real ear to coupler difference. Real ear to coupler difference measurements are really critical for accurate hearing aid fittings in children, but they can be tough to measure in young children. And so we often, when we can't measure the real ear to coupler difference, we'll use an average RECD for that age range. And we have some data in collaboration with work I've been doing with Ryan McCreary, who's also at Boys Town with me and has a lot of expertise on hearing aids, that has demonstrated that a wideband tympanometry measurement can help much more accurately sort of predict the RECD in a given child as opposed to using sort of that average RECD for that age range. So this might be a tool that we could use where it's quite a bit easier in our experience to get these wideband tympanometry measurements as opposed to a good RECD measurement. And in a case where you can't get the RECD, obviously if you can get the RECD, that would be ideal. But if you can't, you might be able to use these wideband measurements to better predict that more closely than, say, using an average RECD. So we are still working on that project and more to come there, but we are pretty optimistic that its ability to characterize some of those ear canal acoustics will prove beneficial for that.
What is your biggest piece of advice to someone who is thinking about incorporating wideband tympanometry into their clinical workflow?
I think my biggest piece of advice is to just start making these measurements. I realize they're somewhat new, and new can sometimes feel scary, and you want to feel like you understand it completely before you're ready to start doing it. But these are so similar in terms of measurement to standard tympanometry. They give you at least as much information as you would get with a standard tympanometry assessment, that if you just start making them, even if you don't fully understand the tracings at first and it takes you a bit of time to start to interpret them, you will very quickly start to learn from them. And so I think just starting to do them, obviously you have to maybe overcome some equipment barriers and things like that, but I think if you just start making them, you will very quickly realize what questions you might have, be able to look for support for those questions and find some answers, but I think you'll quickly realize how beneficial they can be.
Thank you so much for joining us today.
Thank you so much for having me.